today. They said will be joining about 12 o'clock. We had to change the CME code today to 13310. So keep that in mind. I better write that down myself so I remember. So the CME code from Memorial is 13310. I'm trying to find a pen. I apologize. Great.
I think it's in the chat, Paul.
Oh, is it? Good,
Yeah.
good, good, good. Thanks for letting me know that. I really appreciate that. That helps a lot. Okay, good. I just don't like to mess up this stuff. All right, so let's so I think 13310. Yeah, because I want to try to announce that later on too as well. So people joining us will be able to get that as well. All right, it's been cool getting all those CME credits and all that. All right, and then let's see. Just want to see if there's anybody else have to get off by say whatever time it is going to be, noon Eastern, 11. Okay.
Well, I have to be up by 11. Sorry.
All right, I'll try to get you on early, David, and see what's happening in your realm as well. Okay, got it. All right, so I just want to make sure I go over to. I think we have enough. I think we have enough people on board at this point in time. So there it is. Couldn't help it. Got to do it. All right, God. All right, so listen, welcome back everybody to the show. This is the Gathering of Eagles. As usual, it's been really fantastic. This has been an amazing year. I'm not going to say this is the last one of the year. We're going to go to next Tuesday as well. I'll run one. I'm actually on the road here on the way back from Florida to Dallas, and so I was very fortunate to pick up a hotel room that could give me internet. So here I am. And I really appreciate everybody else being on here as well on our day after the winter solstice and the alignment of Saturn and Jupiter, which was really cool to watch last night. I've been tracking it for the last month. So let's start off with a report from, first of all, from the UK. Fiona, why don't you go ahead and tell us what your experience is today, because the Southeast has gotten hit hard too as well, correct?
Yeah, absolutely. Thank you, Paul, and good, well, it's evening for us. Good evening, everybody. So yes, in the first lockdown back in March, April, May, we noticed a significant decrease in cases. But in the second lockdown in November, there was no such decrease in cases. In fact, they continued to rise at a faster rate. And the COVID variant, which I think was first identified in Brazil back in the spring, has been identified as the cause for this. And we've seen a very significant rise in numbers in Kent and now across the southeast, London, Essex, and parts of Hertfordshire. So I saw Fenella's email when she said that it was a more virulent virus. We've not seen that. It doesn't appear to be killing more people. We are seeing longer inpatient stays, but that's because we are ventilating fewer people. More patients are being managed with NIV and are therefore inpatients for longer. But we're not seeing a significant increase in the death rate compared to the first wave.
And we were hearing the same thing from Roberto Fumagalli from Milano last week. He said exactly the same thing you just said. So, but go ahead. And the other thing is,
it's the transmissibility which is higher.
Okay, go ahead. Yes, I'm sorry to interrupt.
It's the transmissibility of this virus which appears to be higher. So there appears to be a 70% increase in transmissibility, which clearly is having a significant impact. From our point of view in the Southeast, we now have 300 of our 4,500 staff off with COVID-related illness or self-isolating, and that's impacting on our ability to manage our control rooms and to provide a response. We've also seen significant difficulties in the hospitals in Kent managing offloads, and we've had very significant delays. So we've had patients who've been in the back of an ambulance for 9 hours when they are known to be COVID positive, which is not good for them, but it's also potentially much more risky for our staff. The other thing I'd like to say is that we have started to roll out the Pfizer-BioNTech vaccine. It's been rolled out to hospitals and to some GP practices, but not specifically to the ambulance services as yet, although we have managed to get some slots both in hospitals and from general practitioners. And that's being done firstly on the basis of those staff who are clinically extremely vulnerable, then those who are over the age of 60, then those who are BAME staff. So I had my vaccine yesterday. My arm's a bit sore. I don't know why they used quite such a large bore needle, but I enjoyed the second dose.
Fiona, it wasn't the large bore needle that's doing that.
Okay, cool. You guys are experts on this, so I'm glad you piped in. Okay, good. Anything else, Fiona?
No, I think that's it. It's just that we have compounding this. We have, of course, EU exit. And Pierre, thanks a lot for closing your boundaries to us. So Kent Park, because France has decided not to let any of our lorries across the channel. Actually, some of them are mostly his lorries, so he's not getting them back, but they're stuck in our lay-bys and on our motorway. So, Pierre, happy Christmas.
Yeah, exactly. So, hey, and now is from your point of view, what have you heard over there from your folks about this more contagious, let's say, transmissible variant? Has that been proven serologically from what you're being told, and does it affect the vaccine? Fiona, yeah. What
Was that for me, Paul?
I want to know what you're hearing from folks in the NHS.
So we're being told that it is a much more transmissible vaccine by a factor of 70%. And we believe that's why we've had the very significant upturn despite the lockdown in November. So London and the Southeast has now moved essentially to a further lockdown. So we had 3 tiers before, with 1 being the lowest, 3 the highest. We've now moved to a higher tier, which essentially means that Christmas is cancelled.
Yeah.
So you can meet with 1 person on Christmas Day outside your family. Okay,
and hopefully it's the baby Jesus. No, hopefully it's not the baby Jesus. I'm sorry it couldn't exist. So, because it's a terrible thing going out there. There are more people dying, and it's awful. So, so let me ask you this then. Let me swing up to to Dublin. Mick, are you seeing the same things you're seeing in the Southeast down in England?
Yes, unfortunately, and I'm down in the Southeast in Ireland, and we had some visitors from the Southeast of England last week. We had a funeral of an elderly gentleman here, and his children came home from London for the funeral.
Yeah.
There's now one of them returned to ICU in London. There's one in ICU in my hospital, one in ICU down the road. One died in the ICU here this morning, and 5 other of his family members in our hospital, with another 150 people infected at the funeral.
Oh, got it. Okay.
Out of 400 people. So this one is very, very transmissible at the moment.
Okay.
The vast bulk of them are obviously not sick to need to come into hospital, but the transmissibility is something significant for us right now and causing a rising daily challenge.
Okay. And Pierre, what about in France? Have you seen such a thing yet, I guess? Maybe is a good way of putting it, right?
Well, not precisely, not yet today, but we are expecting an increase in cases. At the time being, the situation is, let's say, controlled. And clearly for the EMS, COVID is not a lot of work. It's about 10% of our daily activity. So the virus is still there. It's still active, but it's not transmitting again as it has been observed in England recently. Okay. We are about 20% of the beds, ICU beds, occupied by COVID patients, which is a kind of sailing effect plateau we have now for 2 or 3 weeks. And clearly it's stable like this, but we already know that some cases of the new variant of the virus is already in France. We have not observed the contagious effect, but we know the virus is already in. Yeah. And clearly the closing the border and everything and stopping any commercial action between countries, it's more a political effect than an antivirus effect, obviously. And there is a lot of discussion about that. So people say in France, well, they are no more in Europe, we can close the border, and the others say they want to close the border because they are no more in Europe, in UK. So it's a lot of discussion, but for a viral point of view, no difference. We'll have it in about 8 to 15 days. And we are preparing this. clearly. Indeed, it does not seem to me more dangerous than the previous one. However, a lot of patients means a lot of new cases for intensive care unit. That's only mathematics.
Yeah.
So clearly, we thought we were at the end of the second wave in Paris, and I've told you recently the fact that we have an increase for several weeks of cases, then a decrease, and we are waiting for a third wave about, let's say, the mid of January, something like that. So clearly, this is not good news. However, we have sent a lot of people to holidays, all the personnel in EMS and in hospital, because we want them to be able to deal with it increase in few weeks.
Okay.
So that's the situation at the time being. Vaccine has arrived in France, whether it's only by the time being few people that have been vaccinated. I'm looking at Fiona. If she's still in good health in few weeks, I will volunteer myself indeed. But the government decided that the most important point was to vaccinate the people in retirement home and the people taking care of them. That was the first target. And then it will be the hospital, the EMS, and in the hospital first, let's say, the experienced physician and healthcare provider. That means the oldest. Okay?
All right. Shaheem, Donald. Yeah. Oh, go ahead. Yes.
Just we because of the rising number of cases in the UK, we had closed our border yesterday evening, and it's going to be closed until the 10th of January with the UK.
Okay.
But there are over 1 million born Irish people living in the UK who would traditionally all come home for Christmas, or a big number of them. They're now flying into Belfast, which is on the island, and driving down, which is completely ruining the prospect of closing a border. So we're very nervous that over the next few weeks, we will be completely overwhelmed. Today, our own Prime Minister put us into level 5 lockdown countrywide again from St. Stephen's Day, the day after Christmas Day. So for the next 2 days, we have some limited form of transport. After that, we are locked down within 5 kilometers of our houses again.
Yeah.
Okay.
Yeah. In order to finish Paris, one of the points that is clearly difficult is that the government last week decided to stop the lockdown and to replace it by a curfew on evening, early, 8 p.m. And we have millions of people that are from today in holidays. So it's clearly something that will create a lot of movement in the population, and clearly this disseminate again the virus. So these two facts, the new virus and the holidays, is clearly a matter of concern for us.
Okay.
Finish for Paris.
I need to cut everybody off at this point in time so I can get John on since he has to leave. I want to get his reaction to my 2 questions. And then later, Shaheem and Cape Town, I'll come to you to be prepared. So John, since you only have a few minutes left, I apologize for cutting you off or not giving you enough time. But the big questions I have are, this is like serologically or however else we look at this. Is this definitely a different strain or variant? Let's say in its genetic makeup or whatever, or is it just maybe people not being as careful as they were before? That kind of thing. What's your opinion about that?
Yeah, Paul, I have 2 slides I can actually show if I can share my screen right now here as well.
Let him share. Thank you.
Yeah. Okay. Let me know if you can see it. You should see mutations being tracked.
It's coming up now. Yep, you're there.
Yeah, I'm glad I'm sitting 4,000 away from Fiona right now, or actually 7,000 away, wherever you have as well. I have a sore arm too from my Pfizer vaccine, but I'm doing fine. Just to get back to the point here is, number one, I think this is a true problem. And I agree with Fiona. Most of this information is coming from the UK genetic tracking, their COVID unit here as well. And if you notice, there's been multiple mutations, but the one that highlighted in purple are the ones that I think are significant. And the real reason for that, and I'll give you a pictorial diagram, is the following. Number one, if you look at the N501 variant, which is a B117 genetic variant, the affinity to the H2 receptor is much higher. The UK researchers, as Fiona noted, was a much higher R value, up to 0.4, which is huge. And we would agree with Fiona obviously, in the fact that the virus sticks to the surface much more avidly, which would explain the contagiousness of the disease here as well. If you look at the drop mutations highlighted in Delta 6-70 dropped codons, it has about three significant impacts for us. The first one was it is possible to evade immune response. And number two, it could prove to be a problem for some of the diagnostic assay, including what's called the 3-target TAC path assay and a 2-target biofast assay, which a lot of us in the US actually use here as well. And if you look at the N439K, there is an escape from some of the neutralizing antibodies. So there is a potential that the vaccine suppression may be affected, but hopefully the vaccine will actually target the protein. Before I go from this chart, the real reason to track N501Y is that is the center of the RBD binding, the stem of the broccoli protein here as well. I'm going to show you this slide here. If you can see my slide here, these are the mutations. One of the mutations is the receptor binding motif and the terminal. And the mutations actually change the configuration of the attachment, but the N501 is actually in the stem, which is usually preserved genetically. And that's where our vaccine, especially I think the Pfizer as well as the Moderna vaccine, target the ACE inhibitor and the stem. So it may affect definitely some of our assays. Number two is increasing the contagiousness. And number three, it may affect the, I would say, the vaccine or people getting infection again. Back to you, Paul.
Okay, good. So you're saying that there's a possibility that our vaccine may not be as effective against it. Probably be somewhat effective, but not as entirely effective.
Yeah, most of the vaccines do include part of the RBD protein as well as the stem. So I don't want people to go away saying that's going to change the basically the protection from the vaccine. But yeah, there's definitely indication that it's more contagious, and Vienna is on ground zero right now. And I think from what I heard this morning, that's really the case. Is that true, Fiona? Okay.
Yeah, more reason to believe that, again, this is going to be the show that never ends. It's going to be going on, so that kind of thing. So thank you, John, for the report. Anybody have any questions for John or any reaction to that? Okay, good. And then Stefan Polacek, how about in Berlin? Have you had anything new happening there? What's brewing? Are you picking up there as well?
Yeah, hi everybody. Very shortly, we're going in Germany. We went in Germany to a hard lockdown since 6 days now. I think, my personal opinion, too late. We have rising numbers. We have an incidence of about 200 in the whole country now, and we have especially problems in the east of Germany. And there are huge problems with nursing homes, with hospitals with up to 40% drop out of the staff. So we start inter-hospital transfer about for Germany, huge distances in other countries of Germany. In Berlin, we are just stable, and we will start vaccination next week.
All right, thank you. David, David, did you leave already? David first, looks like I just missed him. I was gonna get him on. Are you still there by any chance? If you want to get on for a minute or two? Probably lost him. Looks like he just signed off. I'll apologize. Thank you then, Stefan, really appreciate it. But let me just get a quick, if you don't mind, just anything new to report from Cape Town, how's things in South Africa, before I start going into our main group.
Hi Paul, hi Eagles. Yes, I think we also have issues with the second variant, or we've identified another variant, mostly in the KZN area. You know, we don't really do genetic testing of our tests. Testing is really a problem. So I guess for the moment it hasn't changed. We haven't really materially changed our strategies. We are firmly within the second wave. We are probably seeing numbers higher than we had in the first wave. We are also seeing the impact of the dual pandemic with trauma becoming an issue as we enter into the festive season. As a consequence, we've had alcohol restrictions since our trauma is mostly related to alcohol usage. And there is an attempt, particularly in my part of the world, in the Western Cape, to ban alcohol for the next alcohol sales for the next 3 to 4 weeks, because of the association that we've had. When we had a lockdown, we saw our trauma numbers plummet. And so the big concern right now is the impact of trauma consuming resources that should be allocated to the COVID response. And then outside that, yeah, basic stuff, everyone's exhausted. I think our attempts at the mounting a response to the second wave appear to be inferior to our response in the first. Most of the clinicians, nursing staff, facilities are completely overwhelmed. ICU capacity is also exhausted, and ironically, we are unable to mount the same number of resources that we had in the first wave. Yeah, so it's not too great on this side as we go into Christmas. And I think it's going to be a lonely and dry Christmas for quite a lot of us. I think Paul stepped off.
Jim, do you want to take over until Paul gets back?
Happy to. Thank you, John. Sorry. We are very, very lucky to have our international reports going on and help us all plan ahead. Let's go to national. So, John, since you're up, you want to talk to us about what's happening in the United States and in your line of business.
Oh, payback. Sorry for calling you out on that one. Just a couple of things, folks. Got a call over the weekend from one of the medical directors in the Midwest who had been approached by a local pharmacy who said that they were going to be participating in the federal pharmacy program to get access to vaccines and would be willing to work with the EMS system. In follow-up, what we were able to find out is his individual pharmacy was able to work with the state public health department to get a supply of the vaccines. Having said that, there is a federal pharmacy vaccination program that is in the process of being developed, whereby other chains and independent pharmacies will have access to vaccine when a sufficient supply becomes available. The goal behind that is to help use those pharmacies to help with larger community vaccination initiatives. That program, as I mentioned, is still in development. It's likely that it will not be available until late January or early February. Although, as you're all aware, the distribution of vaccines is so flexible right now that the projections tend to be a little bit long. For example, I was talking with somebody yesterday, one state was expecting to supply their public health departments at the earliest next week and possibly into the beginning of January. Well, they started receiving doses yesterday. We're going to all have to be flexible in terms of how the vaccines are being distributed. We had a good call yesterday on the ECHO series that both Jim and Carl Schultz from California participated on, having to do with ambulance offload times at busy emergency departments. We hope that will be archived and available online later this week. Fiona, I cringed when you commented on 9-hour times in areas of the UK, because we're starting to see that in some areas of the United States again. A program just to make you all aware of that the government is looking at in the context of supporting surge activities. And many of you may have these programs already in your areas, but a number of healthcare systems around the country have started hospital at home programs where they have healthcare resources capable of caring for hospitalized patients who are physically still in their home. So they send out the healthcare providers to take care of them. They have to, by definition, be admitted to a hospital. It's just they're physically cared in other facilities, typically their home. So you may hear more about those types of programs coming up in the future. And then I think this question came up here a couple of days ago, but it continues to come up in other venues. Operation Warp Speed, to address the second dose issue of folks who have already been vaccinated. Operation Warp Speed has withheld the second dose, and they will be sent out to those folks that got the first dose around 10 days to 2 weeks prior to the time that the second dose is scheduled to be administered to folks. So yes, there has been some of the vaccine held in reserve to make sure that we will have enough vaccine when the need arises for the second dose for folks. Those are the updates that I had. Thank you.
John, thank you. A couple things.
Jim, I'm back on, so I just want to make sure you knew I was here. So I don't know what happened. I think the hotel put a gag order on me or something. I don't know. Their internet went down for a few minutes. Okay, but go ahead.
John, the that math on withheld numbers of doses is what's causing some problems at the federal and state level and communication difficulty. And I want everybody to remember the pandemic plans have never planned for 2 vaccines for people, nor for 4 flavors of a vaccine. And when people come in requesting a certain vaccine. So those are going to be challenges to your local public health departments. Paul, John gave a report from the feds, and so I think next in your line was ASEP, and I see Jeff Goodlow and Sandy both aboard.
Okay, good. Yes, Sandy, anything to report from your end?
Nothing except we are working with several docs who are having trouble getting vaccine. They are or getting vaccinated. They work either they're employed or contracted with other agencies and work in EDs, or they're locums part-time. And it's a struggle because every state is different. I don't know of anything else about this. We've got a lot of stuff that's come out with the new bills that were passed on surprise billing, et cetera, but I'll let Jeff see if he wants to talk about anything. Anything, Jeff?
Okay, anything to add, Jeff Goodlow?
Yeah, so I think our esteemed colleague Dr. Carlee put this all in context. As much as our interest is appropriately on the pandemic, often up to 90% of our other work is still our day-to-day other categories of issues, and so particularly proud of Team ASEP and all the great advocacy that has come to fruition just in the last several days in DC. For those of you that have EMS systems that are challenged with issues related to substance abuse in patients, and that would be, I think, 100% of us, a great win on medication-assisted treatment. I won't take much bandwidth today on that, but just know that it has never been easier to initiate now a 3-day buprenorphine plan in the ED at the first and really only visit necessary now for patients. Please look for more of that in ASEP literature soon to be released. And then also a tremendous amount of work just in literally the last 24, 48 hours with this end of year package passed by Congress. Out of network billing was in there. It does have impact in the realm of EMS as well. And while the final package is not perfect, much of what we have been working to change from the earlier versions 18 plus months ago did fortunately make it in this last package. So a lot to be relatively thankful for in terms of the fiscal part of our work related to what could have been. So just can't say enough about our great DC team at ACEP and all the many physicians we have working with them. So thanks for the time.
Yeah, I would just add on to that. Initially, when we got the news that we had a 6% cut coming down, the DC office was like, wow, we dodged a bullet because it was going to be much worse. But through their efforts and the efforts of others, that 6% cut is a 2% cut. So while 6%, 2%, all of those sound bad, I will take the 2% over the 6% over the 9%. And in this world today, you know, I'll take it.
Sounds good. Hey, Jeff, you were one of the first people to get the vaccination amongst our group. I suspect that at least a third of our group has gotten it yet, if not more. But tell us, how did that go from your end? Did you have a reaction or anything like that?
Yeah, so super grateful. We just have such an amazing public health team here. I know that Oklahoma is frequently toward the very bottom of health indices for many reasons, but it is not for lack of very hardworking public health professionals. And so I have had just a wonderful working relationship with them over these past several months. Honestly, I think probably to nobody's surprise on the call, they reached out to me primarily to serve as an example for our EMS folks and the community regarding the safety and reliability of this vaccine. So I could not say yes fast enough to agree to be one of the first in line and do media related conversations, you know, because of that. Honestly, just another vaccine. I think many of us have had, you know, so many we have lost count over our careers. And so, you know, emotionally, symbolically, this was not just another one, but logistically, it really was just another vaccine. And I've had zero complications. I'm sorry for all of those of you with sore arms, maybe lift some more weights or something like that, and try to be as physically fit as Michael Kaufman. But for those of us, you know, honestly, it's been great. It's just been fantastic. I really have appreciated the multiple media outreaches here in Oklahoma to help spread the word. And I do think it is helping to make the needle go up, no pun intended, make the needle go up just a little bit and help some of our EMS folks be more encouraged to get the vaccine. The last point, and you know, I'm sure many of you have experienced this or will, despite putting a lot of information out to our EMS system here locally over these last several months, I still get individual phone calls and emails. Hey, do you really think it's safe? Even knowing that I got the vaccine this last week, you know, do you really think it's safe? So just, you know, I think there very much is a part of the dynamic here where individual EMTs and medics, they just need that one-on-one encouragement from the doc, so to speak.
Well, that's a good, I think, segue into one of the things I was going to kind of do here. So I wanted to talk about, I don't know, hey, Walt Dix, are you on by any chance? I don't know if Walt is on, but I wanted to thank Jim Augustine and Ken Shepke in particular, because he helped me out. We've been actually hitting a lot of the districts for the IAFF. So we had District 12 covers, I think, the whole South, like I think Alabama, Mississippi, Georgia, South the Carolinas, Florida, and got to be on there. But Walt, are you there by any chance? I thought I saw your phone number up there. But Walt is the vice president for the IAFF and arranged that, and the feedback that we got was really great. I did actually do a presentation with Peter Antevy, not too long ago using the same information we've been going around to our different fire departments in South Florida, and did one for our Broward Sheriff's Office tactical team. And the captain in charge of that, who was the real, as far as I'm concerned, major hero and a real lifesaver at the Parkland shooting, is on the phone with us today, Grant Lassiter. And I have a great picture of Grant and I about an hour before the shooting went down, because we were doing some training in there. But we did a update for the team there. And Grant, what was your, can you get on if you're available? Tell us, what was the reaction from your team after we did our before and after, I guess.
Are you able to hear me okay?
Yes, we can, sir. Yes. So this is Captain Lassiter. That's from the Broward Sheriff's Office. Yeah.
Nice to meet everybody. I think as far as my team goes, we have 10 guys. I would say that before the talk, 60% of them were leaning towards not getting it. And at this point, we have only one person that's still on the fence, but going throughout, we're a pretty large municipality, and going throughout all of our fire stations, as crazy as it sounds, I would, if I had to put a number on it, I would say it's like 50-50 people that are willing to get it. And there's a lot of people that are still on the fence. So I think pushing that information out like you did with Dr. Antebi last week would be super beneficial.
That's great. And that's the feedback I got from you. I wanted to make sure everybody heard it, but I think that was a small biopsy, 10 people. But for example, in Alaska at Anchorage, they had only maybe 35% that were interested before. And now they pushed it up over to 85%. And talking to Mike Levy last night, I was waiting for Mike to get on. I was trying to time it with him there, but he's out in Fort Collins right now, Colorado. So that's basically it. And you're on duty today, right, Captain? Is that right?
I'm actually in the fire truck as we speak.
Okay, got it. Okay, got it. Okay, good. Are you on a run or just took the call from there?
No, we had a car fire earlier. We're on our way back.
Okay, good. Well, thanks for joining us. Really appreciate it. And it's great to see you. And it was great getting together with you this weekend. So I really appreciate it. All right. Anybody else have stories from their area about the hesitancy thing? Glenn, it was famous that FDNY people said they were like 50-50. And has that changed at all as far as you know? See, Glenn has said you'll get on in a second on the 337 number, I'm sure. Maybe Glenn's busy right now, so that's too bad. I saw him here on the call. So we're just, sometimes he just has time. So Glenn Asada, I'll just give you one more shout out there. Okay. Nope. Okay. Well, hopefully we'll catch him in a little while if he can get back on. I want to see what's happened. Anybody else have any data where you guys changed? Any of you guys had anything where you think you've changed it with your education? We certainly saw as we went around the state of Florida, particularly thanks to Ken Shepke, Jim Augustine, and those guys. Anybody else?
Yeah, Paul, absolutely. We, Ken actually spoke at our state EMS conference. It's probably been a week or a week and a half ago now. And quite frankly, I mean, somewhat anecdotally, but we saw acceptance of the vaccine jump dramatically. And I've adapted some of the slides from Ken's talk and given that just again, as recently as last night, it helped tremendously. So thank you, Ken, truly.
Yeah. Paul, we had another thing that was effective just to Jeff Goodlow's point earlier. We had a couple of our African-American faculty get on the TV and get the vaccine, and it changed the staff at the hospital's view from about 50% that were refusing it to only 5 of over 250 that have now refused it, just after seeing that group get on the news and get that first dose. So I think the addition of the education plus the leadership example out front is making a huge difference, and it really made a difference in our people of color and their communities in terms of their confidence in the vaccine. Okay, good. Anybody else have any particular experiences that you think where you really improved the and what were is it just getting people out there that know that are up to date on things and so on that pays off here? For example, I was going to play for you today, but I didn't show up on my video yet. Is Dr. Fauci getting his vaccine about an hour ago, and I got a good video of him doing it. Maybe I'll show it to you later on. But he's got it. Francis Collin got it. Azar got it. So hopefully that is going to increase the confidence in that whole arena. Okay.
Let's see, Ken, do you want to actually speak on that a little bit? Because you've had to do a lot, you and Angus were out there rocking across the state and are really moving along with the uptakes, right?
Yeah, I don't have actual before and after survey numbers to give you, but we've done a lot of education on this, not just like Michael just mentioned, and for the firefighters, et cetera, but even for our EMS strike teams, we put on these lectures, and I had so many folks come up to me afterwards and say, now that I understand the vaccine, now I was not going to get it before, but now I'm going to go get it. So it definitely, knowledge helps folks. It takes away the fear, and I keep doing the same message, which I'm not trying to be a salesman for the vaccine. I just want you to make an informed decision. So we're going to give you the facts behind this thing, and just to dispel the myths about this stuff. It's that you can't catch COVID from it. It's not going to change your DNA, and there's all sorts of wild theories out there about what's going on here. So I think just having that education helps. What was that?
Change my DNA? Oh my God. Okay. Hey, listen, but it gets rid of the sniffles. I want you to know that.
So I think there's no question that giving folks the scientific answers really gives them the confidence in the vaccine.
Yeah, the dog on pony act that we did with Jim, I thought was very, very useful. And it was good because I think you came across great because you were being objective, whereas I'm saying, I treat, my approach to this is, do I do this for my family member? And the answer is yes, I would. And so, so it was good. It was a good cop, bad cop approach. It was really good. So thanks a lot. Anybody else have any reactions in their neck of the woods to what's going on there? So
can I chime in for a second, Paul?
Absolutely, Angus.
So interesting for us, we were participating with Dr. Shepke's strike teams and getting some amazing numbers of folks in long-term care facilities vaccinated last week. And then we had the opportunity come with some short notice to take several hundred doses for our own medics. And so with about a 12-hour notice, we vaccinated nearly 300 medics yesterday. And we're actually outpacing our available scheduling slots today and tomorrow. So we've had a bit more uptake than we would have expected from our previous surveys. And I think as the sort of first round of medics are receiving the vaccine and going back and talking to folks, that we're seeing the uptake grow. So we're going to be at 500 vaccinated by the end of today, and that's just with 2 days of offering. So that's 25% right there of our workforce.
Fantastic. Hey, Angus, by any chance, you're piping in the Florida Metal Eagles, so to speak, right? And Florida show. Yep. By any chance, is Wayne Lee on with you guys? Do you see? Can you tell?
I do not see Wayne in the room right now.
All right, great. I just want to get him on maybe next week because I want to give a special salute out to him just for some of the reasons we've talked about. Okay, so let's see.
Paul?
Yes, go ahead. Yes.
Have Erica Carney report. She got half an inch taller with the vaccine. I think we need to add that to all of our instructive materials for the firefighters.
Okay,
hold on. That's because COVID makes you a half inch shorter, so it just counteracted the initial effect, I think, is what it was.
So Erica grew an inch. I got a fifth toe, right? Hey, so how are you, Erica? What's going on with you?
Good. I've got my son in the background who's not in school, so it's quite noisy on my end, but I'm just grateful to see all your faces. Our current battle right now is getting our EMS crews vaccinated as well. They were demoted to 1B and hopefully not the second tier. So that's our big battle right now.
Uh-oh. I'm afraid we lost Paul again.
He was shocked that I'm taller. I think that's.
All right. Erica, thank you.
We can still see Paul. He's just frozen.
Is he? I didn't see him. So, all right, Chris Colwell, report out. Everything okay with you?
Sir, yes, we are. We're hanging in. We did have a surprising resistance to the vaccine, and I agree the education stuff, and I agree. My thanks for Ken and so many others that played a role in that have really helped. And we found a dramatic example. We have a lot of mistrust particularly in some of our underserved communities, and it really helped to get some people out front getting those vaccines, leading by example from their communities, and it really it made a difference for us. We're kind of teetering on the edge. We've still got about 15% ICU capacity. We're not seeing wall times of anything dramatic yet in the city, but we're filling up, and so we're holding steady. And when I listen to this group, I feel very, very fortunate, even though it feels like we're in a rough spot as well.
Very good. Thank you. We keep hearing about California and you guys heading underwater. So you're going to be a bellwether for us for a while, I think.
Yeah, I think San Francisco is in a little better shape than a lot of the rest of California, particularly Southern California. Imperial County, which is down in the southeast, is in really bad shape. They're asking for 55 ICU COVID beds that nobody in the state has. So bad shape, but San Francisco is holding okay.
Very good. Okay. Mike Kaufman, you've been working at the state level on this. Can you give us your perspective and your survey results?
Yeah, so as we've been looking across our state to try to increase our number of available vaccinators, the next logical source for those are going to come from our basic EMTs. So, you know, it was probably about a year and a half ago and somewhat time fortuitous, our state passed legislation to allow our EMTs to give epinephrine via needle and syringe. And that couldn't be more timely, right? Since we need more vaccinators, they've all been trained on how to give IM injections and can give the antidote if there happens to be an anaphylactic reaction. Interestingly, and John Cromer may have presented some of this data at a previous meeting, NASEMSO had done a survey on this very early on in the pandemic where they surveyed states. When we look at that survey, just to share some of those results with you, 28 of the 45 states that responded said that EMS can administer vaccinations. 10 of those states responded that they could only do so during a declared emergency. 35 of 38 states that responded to this question said that vaccine administration is limited to specific providers. Of those 35, 100% said paramedics can give vaccines, 43% said advanced EMTs could, and only 11% said that the basic EMTs could. So with conversations this morning, we're actually reopening that survey and we're going to try to update it to see which states allow basic EMTs to do that. And I was actually just reviewing an executive order that's going to be coming from our state that will allow EMTs to do that. That'll increase our vaccinator pool by about 15,000 certified individuals. So definitely a help to the problem.
Mike, does that conflict with the Medical Practice Act in the state, I wonder? This is Fowler.
Yeah, so it doesn't, and it specifically is saying that if it's within their scope of practice, that they can administer vaccines.
So like years ago, when we were worrying about smallpox after 9/11, we actually, in the state of Texas anyways, we are able to delegate just about to anybody. And so there was provision that we would do it for just even basic firefighters, let alone EMTs, to be able to help us, because if you had only 60 people in the health department who'd have to stagger shifts or whatever to get millions of people vaccinated, you really needed a workforce there. And that's how we were thinking of doing it. And this actually may be a good thing for various other deals, which is like if we want to do flu shots or anything else in the future, or the next SARS du jour that we have to deal with, that would be good. There was a question about medical direction coverage for the vaccinators. Ken, do you want to address that? Because you were all over that early on several weeks ago.
You know what, before I get into that, Paul, I think it's worthwhile listening to Angus tell a little more about our program with the nursing homes in Pinellas, because I think it's a great model to share. Okay, got it. You want to go ahead, Angus?
Sure. So it's really Ken's program. He sort of federalized my troops, but for lack of a better word. But we spent 5 days with 40 paramedics and 25 guardsmen, and we hit all 60-something skilled nursing facilities in our county, and we vaccinated 6,700 residents and staff in 5 days. We had very few adverse reactions, nothing that looked like true anaphylaxis. We had 1 or 2 EMTs in there not administering, but helping with record keeping and things of that nature. We saw roughly a 70 to 80% uptake among residents, and about a 25 to 30% uptake among staff. So that's just an amazing amount of work that went into that over those days, and really successful as a pilot demonstration program for what could be accomplished in a county that has just a really densely, a really large amount of at-risk people in long-term care facilities. So, that was sort of the lead up to us being able to vaccinate ourselves there as an additional pilot on the tail end of that. But
what's your speculation why the providers didn't want to take it?
So I think it's sort of the same as the general public. We're talking about, a small number of nurses, but mostly CNAs and techs and things like that in our nursing facilities. So I think it's no different from the rest of the public, most likely.
Angus, are you going to write that up pretty quick and get it out somewhere?
I think Ken should definitely write that.
No, I mean, that's important. That's important. And especially in EMS focused nursing home frontier, I just would encourage you to do that. I'll be happy to help if Paul doesn't. So.
Well, one thing I know is, Hillary, are you on by any chance? Because that could be another focus we could get out as a story through, a quick and dirty story, so to speak, getting it out through EMS World. We could talk to her offline. She was on earlier today, so maybe that might be one method, Ray. So that's a great one. Okay.
So let me make sure the credit goes where it's supposed to be, because this is really Steve McCoy's model, and I just carried it out. So Steve McCoy is our state EMS administrator. Basically the fire chief at the, the equivalent of the fire chief at the state Bureau of EMS standpoint. He's not a fire chief, but that's his position. He's the head of it. This was his idea, and we basically took it off the model where we were going around testing all the nursing home residents and all the nursing home staff and doing infection control procedures. We just changed out the swabs for the vaccines and added a bunch of education to it, but it worked really, really well. We did all of Broward County, which is one of our largest counties in the state, in 5 or 6 days, all the nursing homes there. And you just heard Pinellas, the same thing. And so the model works really great. And the reason why we did that is because we had all this vaccine. And while the pharmacies are going to be doing that, we didn't want the vaccine to sit on the shelf for a week, so we actually took the program, went out there. And now what our plan is, we're going to continue to use these teams as needed to beef up the various pharmacy programs. So either they'll go in advance and get stuff ready for them, get consents, et cetera. But if there's an area they can't get to, again, EMS is so mobile and so versatile. It's just a great resource. And we're not just going to use it for this. We're going to continue to use this as we roll it out, as we go through the various phases, the different target populations.
Well, Ken, what I was worried about, this is Ray again, was that we saw overseas that there were a modest number of adverse reactions, and then we wrote that up last week. Now we need to get out into the lexicon the fact that, in fact, the adverse reactions are manageable and can be managed by a set of medics giving vaccinations. So we need to get that out there.
Yeah, one of our models is we had a rescue staged at each of our sites, and then each of our vaccinator teams all had EpiPens, so that if the rescue happened to be off-site because they were transporting doing something, that vaccinations didn't stop, we had the rescue EpiPens there just in case. So it went great. We had very little problems with the thing, and the uptake was really surprisingly strong. I was worried it was going to be less. We didn't provide any specific education. Like we did give, we've been talking about giving the education on the vaccines to EMS. I don't think the nursing homes have been beneficiaries of that. To have that high uptake among the residents was fantastic.
Paul, this is AJ.
Yeah. I think we lost
Paul, this is AJ.
Hey, AJ.
AJ, go ahead.
Go ahead, buddy.
I was going to ask if Angus calls me, we'll tape an EMS Today Show episode and I'll blast it out quickly.
Excellent.
We'll Zoom it. So Angus.
Yeah, I didn't see that you were on here, AJ. Sorry about that. Are you the 760?
No.
Is that you?
Yeah, that's me. If somebody can zip me, Angus, if you can send me your phone number, I'll take care of it.
Great.
Okay.
Good. Oh, glad you're on then, AJ. I really appreciate that. That's a great idea. Okay. Sorry, didn't see that you were on. Apologize.
No, that's okay. I'm on the road.
Okay, got it. All right. Hey, listen, Amal, you got to go. Is that right? Not you? You may have already gone. I'd say he just texted me and said that he can do it. His cards update next week. It's not anything real urgent, so we can do that next. I do want to, Jim, do you have any reports before I swing into something else on the psychological things going on? So.
Yeah, very quickly, the fire chiefs group is discussing mandatory vaccines. And I made it very clear to them that we're not in a position to mandate vaccines at this point. Legally, it would not fly and would create a lot of animosity until we have better results of the vaccines, when we may make a very learned attempt to mandate either vaccines or antibodies. Second, that phasing document I sent to all of you, and thanks for the feedback, is really where the fire chiefs are headed now. And maybe phasing isn't correct as much as theaters, Paul. That our current theater is taking care of mobs of patients and getting this initial vaccine dosing out and building confidence, and then moving into later theaters. And the third is really this offload time issue, which John Kramer covered earlier. Thanks.
Yes. Okay. Got it. All righty. All right. And nothing. And then, have you gotten any feedback about what we did for District 12, the AAFF?
It was very positive, Paul. Went into Georgia. I'll tell you, for all of you, your individual ability to converse and to relay confidence makes a world of difference. And especially when you're using materials from Paul Pepe and Shepke and Jameson and others, we have a great influence. We should use it in these good times to be using it.
So, interesting thing. I kept cutting out here, and I apologize with whatever is wrong with the internet here at the hotel. But one of the things I was saying is that what I discovered 2 or 3 days later, that there is a little bit of more of a jump in my step, so to speak, and I'm really just feeling much better psychologically. Even if I still have 2 more weeks before I get the second dose or whatever, and then we got new strains coming out, et cetera. There's always something, right? But one of the things that we were going to talk about, and several of you have been on, has been the theater war thing that they put on for ACEP. And I don't know if Sandy's still here or not, but it was extremely well received, et cetera. So we're planning on maybe running it down at our Eagles meeting down in Florida, that we're with the presumption that we're all going to be vaccinated and going to get together in person that second week, or wherever it is, third week of June 14th through the 18th. And all that. And so the person who's been responsible for that theater war for the last, almost a decade and a half, for the DOD and various other people, has been running it now on Zoom meetings, where he had over 1,500 live audience with hundreds of people in the audience, running these things where you had famous actors doing Greek plays and Greek tragedies, and which was his kind of area of interest years ago as a fine arts major and so on, and master fine MFA. And so he's been able to retask them to start talking about why that affects, what happened in Greek tragedy speaks to a lot about the human condition today. And so, Brian, you've been conducting a lot of these things, mostly with emergency medicine people over the last 2 or 3 months, large, like, for example, at ACEP, there were 300 people in the audience, et cetera. But you did one for FDNY. You're going to start branching out into EMS a little bit, like with us, et cetera. And can you tell us an initial reaction that you're seeing, or what you think is going out there, or what you're hearing as people talk about their reaction to the play and what they're going through? I was wondering if you wouldn't mind. I guess you and Marge Lane are on today, and thank you both for the incredible labor of love that you guys do. It's been really helpful. So, but go ahead.
Thanks, Paul. I would be just honored to just listen to this call. So thanks for the opportunity to say a couple words. I don't want to take much time, but just to say, we've been out in the field listening to EMS professionals. We started with a performance or a session that was co-sponsored by the Uniformed EMS Union in New York City. And that was really powerful, especially because as members of the union, especially leadership, they were unfettered and able to really speak their minds without fear of any retribution. And that was in July. We heard all kinds of things about the first wave and their experience in New York City in particular, with the unfolding emergency that was exponential in nature in terms of what they usually saw. So they talked about having 8 or 9 cardiac arrests during the pandemic, in a day where they might have 1 in the past, and that sort of accrued impact on them. that they couldn't pretend like it didn't affect them, and the feeling that maybe they were deviating from their own standards of care, the inability to actually save a lot of the people that they were going to rescue and bring to medical care. Fast forward to the last month, where we've performed the last 2 months for ACEP twice, and also we've had a lot of the same EMS and EMT folks return to performances we've done for medical facilities like Montefiore and NYU Langone and Mount Sinai and others in New York City. And by the way, these have been viewed on Zoom by up to 30 countries, so it's not simply relegated to New York City. We've been hearing from people all over the planet. And a lot of the EMS professionals you've talked have spoken about a feeling of betrayal, the betrayal of having sacrificed so much, of having put so much on the line, and then see people pretending like the disease does not exist, or seeing people in other parts of the country code and die while denying the existence of the disease itself, and seeing people flout and ignore public health measures, and knowing the impact it's going to have in places around the country that hadn't at that point seen what New York City had seen. The flip side of all that is that we've seen a lot of healing, and what we provide isn't really about the arts. It's just an opportunity for people to name what they're experiencing and not feel judged. And the main character of the play that we perform for EMS the most is this character Ajax, who's this ancient warrior who loses his best friend in battle, and after 9 years of fighting, does something that he feels to be shameful, that goes against the grain of his own standards, and ultimately in the play takes his own life. And the play is really about naming that feeling and acknowledging that it's natural to feel it, and then creating the conditions where we can avert suicide and burnout and other things before it's too late. In ancient Greek, Ajax, this great strong warrior, is called unbendable or inflexible. And at the end of a recent session with ACEP, this emergency medicine physician, senior physician, ended the session by saying, I feel compelled to speak and acknowledge that I burned out, and it was because I was inflexible. I didn't bend. And so she closed out this session we had with ACEP after doing the performance by saying, for her, the message of the play was, you must bend. You must find flexibility. You must find a way to be vulnerable and serve patients. And if you don't bend, she said, you will break just like Ajax. And then she said, you will break just like I did. And it's one thing for us to perform ancient plays, but to hear a senior medical professional say that, it's not about being weak, it's about being flexible.
Yeah,
was a really powerful message for people.
And I think the other thing I heard going on more recently amongst the groups, both EMS and emergency medicine, has been the fatigue thing is really kicked in a lot. You know how long it's just like, and we saw the same thing with those guys in the ancient warriors in terms of the wars that went on for 10 years with plague, with other things, all that. So anyways, I just wanted to give people a heads up and get to meet you, because I'm hoping that we're going to have you to be there with us and all that. And thank you for tracking us and listening in. I just saw you there and I said, why don't I take advantage of that? Because the psychological aspect is, I'll say, I'm feeling much better nowadays just because of the vaccine, and it's given some hope there, and I hope that helps change things down here. But the issue that you brought up about betrayal, and then there's also the feeling of like betrayal, say because you didn't get enough PPE equipment or something. You were hearing this constantly, or or in other words, you're feeling let down and betrayal from the people that you lead. But then it's a mixed feeling, because then you say, well, it's not in their power, they're not creating this, and so there's those guilt things. So there's a lot of emotions at play here at the same time, and they're just going on and on. So it's going to be interesting. So the best thing, though, I think has been this right here, is everybody getting together and so on. So thank you for joining our team. I want to say, anybody have any questions for Brian, by the way? Let me ask, has anybody seen any of the performances, such as the ACEP performance that's on here today? You can comment on it. Anybody there that saw it? Maybe not then. I know that Sandy Schneider Yes, go ahead.
Paul, this is John. I saw it and it was fabulous. I mean, it's hard to describe until you've been through it.
Yeah. Okay, good. Well, good feedback for you. And then, hey, Brian, if you don't mind, can you introduce Marjolaine and tell us about what she does for you?
So on the call, we also have Marjolaine Goldsmith. She wears many hats. I don't see her here, but I'm sure she's, Marjolaine, if you want to unmute yourself and say hello. Marjolaine is our company manager. She's an actor. She's also really the producer of all of our online events. She kind of figured out how to leverage Zoom and make it work. And it's kind of revolutionized our work. Our first performance, as Paul mentioned, we have 15,000 people from 40 countries engaging, and it's only gotten better and deeper. Every continent except for Antarctica. And if any of the Eagles know anyone in Antarctica, it'd be great, because we'd love to add that last continent to our list.
They haven't had any cases down there, by the way. I talked to them. Get you plugged in. You want to do every continent. That sounds good. Marjolaine, you want to say to everybody?
Just that it's such a tremendous privilege to be here and to bear witness, and that I think it's no accident that telehealth is the same mode by which we are healing thousands of people across the world. And that's been a truly transcendent experience. And my only hope is that we reach more and more of the unconverted who can also bear witness to this, because I know what a privilege it is to hear directly from the front lines. And it's exactly why I've been in lockdown since March with my family. And I only try to, promote that. And so anything I can do to serve and create a platform for all the work you're doing is and amplify it is my civic duty.
Okay, good. How's it been to listen in to what we're talking about? Is it boring inside baseball, or is it interesting for you?
No, it is the most transcendent experience of my life. It's incredible. And it's actually the biggest spiritual healing that I've had in the entire, year of this pandemic.
Okay, and why is that? Because there's people out here doing it and trying to help out and all that kind of thing.
Yeah, and it corroborates all of my fears and all of my frustrations with my generation, particularly with their kind of glib approach to convening and carrying on. And also the thing that's been most transcendent about the performances was I'm forgetting his position, but he was saying that there's this analogy of the bow in Philoctetes and the wound in the bow and all of this stuff, and setting up this kind of false equivalency between the economy and human life through the metaphor of this play was hugely healing for me, because with the elections and everything, and in terms of leadership, it's been such a frustrating thing to bear witness to. And also the fact that you guys are able to do this on Zoom, and then our debates don't happen on Zoom, and then we're around messaging and everything like that. It's really amazing to hear how that works ideationally.
Cool. Well, that's great. Well, anyways, really, we just appreciate all the work that you guys have done over the years, and you've made it better for veterans. You've made it better for active military, now the emergency medicine community and frontline. So we thank you, and we hope to see you in person in Fort Lauderdale, Hollywood in June. Okay, so we'll make sure you get vaccine, because you're supporting the frontline troops here. Okay,
wow.
So it's good. Okay.
Thanks, Paul. We'll be there.
Well, you're welcome to stay on with us, okay? And then let me move on.
We're gonna keep listening.
Yeah.
Okay, yeah, okay, got it. Hey, let me go to New York City. John, are you, I'm sorry, Glenn Aceda, New York City medical director. Can you get on with us? Are you live?
Hey, everybody. Yes, I am.
So I tried to hit you earlier today because we were talking about the people who were, hesitators. It was famous how we were like 50-50 in New York early on. Has that changed at all? And have we done educational programs like you've heard around here today?
Yeah, I'm sorry. I thought you were going to ask me, but I had to take another call outside. Anyway, so you may have seen the survey that our fire union did. And this is probably about 3 weeks ago. They reported that 55% of our firefighters would not be getting the vaccine. That was 2,000 of our 11,500 firefighters that they surveyed. Now, the union president for the fire side, UFA president, said, no, he's going to get the vaccine, and he's encouraging. Some of those numbers could have been 55% because some felt that they were already antibody positive, they were exposed, and they felt maybe we don't need it. So we did do an educational session. We had 4 sessions. Our Bureau of Health Services, as well as the chief of department, went remotely, and it's been videotaped, to talk about the vaccine and the fact that even if you were antibody positive exposed in the past, you should get it. Some of the thought might be that of the 55%, 35% might be saying, no, I'm not getting it because they felt they were antibody positive and felt, oh, I already have immunity. So our campaign was to say, no, no, we encourage you to get that anyway. 4 sessions have gone by. We actually start our vaccination program tomorrow. We're predicting 300 to 400 members per day. EMS in New York State was put on the 1A list. So we're starting with EMS first.
Right.
And then fire is still on the 1B list according to the state. So our point of distribution vaccination sites begin at 3 sites tomorrow. And we don't have it as mandated. Right now, our nurses and some temporary nurses are going to be administering. We're trying to get the state to approve our medics to be able to vaccinate as well. They have our State Emergency Medical Advisory Council has in the past approved even EMTs to vaccinate, but because they do a check and inject for epinephrine. When we were running out of EpiPens, the state approved for EMTs to actually, withdraw from the vial and inject. So the state felt comfortable that they could actually do the vaccination. There's a training program that's required. We put one together. The state's advising that they actually have to put one together, which oftentimes they'll put something similar to ours. So we're waiting for final approval of that, as well as the medical control issue is a little bit difficult. What the state seems to be leaning on is that if a physician, a nurse practitioner, or a PA is on site, then the paramedics could actually give the vaccination. We want to try to push it to what we do every day with our paramedics. For protocol, we have online medical control as necessary, and I always have one deputy medical director on call. So if anything needs to have done, I can get them to the pod site as well. So we are starting tomorrow with nurses. We're hoping that the state in the next hour or so advises us that we can go ahead and use our paramedics. We're not pushing for the EMTs at this point because we think that's just going to take a little more time. We just want to get our paramedics. We're looking at line of duty injured paramedics that are not in the field, so to speak, but that can still provide vaccinations because we're always worried about the second peak and volume being high again. We need our medics that are able to be in the field to be in the field.
All right. Well, thanks then, Glenn. So it'd be interesting to see your follow-up to see if you have more people taking it than how we started. Maybe some people were just waiting to see and then, go with the herd, so to speak. We'll see how that goes. A new form of what do you call it? Herd immunity, that kind of thing. Yep. So, hey, or herd mentality, right? Whatever it was. Hey, David Miramontes, so you said 61 to 63 showed up yesterday and got shots. Is that right?
Yeah, I was pleasantly surprised. So we thought there'd be a big pushback. So this is our EMS division. These are the guys that are on the ambulance every day. We'd expect fire will be lower, but I was pleasantly surprised. I was teaching yesterday and we had 7 people in the class that weren't going to take the vaccine. By the time I was done barking at them, they all at the break contacted their supervisor and got signed up. So I think it takes some strong education and reinforcement. Contrary to what some of the protocols for EMS are out there, I have no problem giving it to pregnant, lactating, or folks that want to get pregnant. This vaccine's really safe. It was safe enough that I let my wife go in the clinical trial. So I think it's a good deal. So I think we just need to keep the message going that this is a safe vaccine. Yeah, your arm's going to hurt. So I do want to mention one thing though. We had a weird case of asymptomatic COVID being unmasked by the vaccine. So this gentleman he's actually one of my teachers in my office, one of my instructors. He was asymptomatic. He was totally normal, and had his vaccine, and he reacted more so than anybody in our group. So he had a low-grade fever, muscle aches, his arm really hurt. He really felt crappy. And even though he's 67, this guy's a Marine. He's in better shape than everybody on this call. And so he ended up getting tested, and he was COVID positive. So the vaccine mounted an immune response and actually unmasked his asymptomatic COVID infection, which is really weird. So if you have folks that are just not reacting to the vaccine properly, a lot of the guidance is wait 72 hours to test them. I don't think that's a good idea. I think should be testing them early so we know and can do contact tracing.
Okay. All right. Well, good input then. Thank you so much. And great thanks as usual for the great work. And by the way, for the people that are joining us from the outside world, so to speak, such as Marjolaine and Brian, is that so we've heard from today from people from such as the medical former CEO of the London Ambulance Service and now a person who takes care of things in the southeast of England to Berlin to Paris, to Dublin, etc., and Cape Town today. And then we had medical directors from San Francisco, medical directors from, state of Indiana, state of Florida. I could keep going on and on, but it's just been a great group. And David here, as we just heard, is the medical director for San Antonio. We heard the medical director from New York on before, etc. And so, and dozens of other great people on the call with us today. So let's see. Last thing I wanted to move on to is, does anybody have anything they want to pipe in about or say before I get off to the next event I want to talk about? So much for Inoculation Nation then for today.
Paul,
one thing. Yes, go ahead.
Just one sentence just to say that so much information about vaccine safety, who can do it, and the preparation for adverse reactions was discussed in the last hour. We have to get this out there so that we can break the resistance toward taking vaccines.
Yeah, well, we've been doing pretty good, yes, with the information we've been doing over the last 3 weeks, I think, and thanks to Ken and some of the others that were on the call. Kevin Mackey did a great job, et cetera, and so on. And so I could go on. I mean, all of us have in our individuals because we have to be the experts and know the people in those areas. So thank you all for what you've done here. I think it's going to make a difference. Let me ask this. Chris Colwell, are you still on San Francisco? Chris, are you still there? Yes, he is. It looks like he's there anyways. Chris?
He reported out to us earlier, Paul.
He said he was getting off because it looks like he's still there. That's right. I just wanted to see, I'm trying to remember, was anybody else here involved with the refresh program? Anybody there that was involved with refresh? That was your lecture for.
This is Joelle, I was.
Yeah, so have you looked at it and seen what they've done so far? Have you looked at other things besides your own presentation?
I've been watching the numbers, over 9,092 countries, and just simply phenomenal content.
Okay, good.
In all topics.
Yeah, I've heard that it's already hit over 10,000. I was on the phone. We were on a meeting with some the other day. Said, "Oh, we just broke 11,000 or whatever it is." So Joelle, can you tell them real briefly what it is that we're talking about?
Yeah, thanks, Paul. This is free continuing education for paramedics. Although I have to say, it's really at a level that even as physicians, it's just great information. But they how all the paramedics have CE requirements that are topic specific. This is a free to register and enroll course that covers all of the topics. You can get all of your CE covered. It's at least 30 hours and hits everything you need to refresh. And huge name hitters. You've got Jarvis, Wang, Pepe, and Tevi. Who've I could go on. There's a lot of great topics, and all the professors did it just out of their own time, and they uploaded it, and it started out as this small idea and has just expounded and exploded, and honored to be part of the faculty. Thank you.
Oh, good. Well, anyways, yeah, so it's the National Registry of EMTs is sort of a focused here, putting on as their refresh course, again, for free, over 30 hours of content. There's actually some bonus content as well that you can get the CE for. And I think we've talked about it on this call before. I don't have the information here. If anybody has it, if they can put it on, how you can register, get your folks to register and get on. It's just, like I said, you're right, that it's so good. It's so up to date and cutting edge that we're getting, and we've had a lot of people from, Sophia Dyer on, Chris Colwell, as we said before, yourself. So a lot of really great talks that were given there. Meg, did you do one of those as well? Meg Marina, were you on one of those, if I remember?
I did. Thank you so much. It was.
Can't hear you very well. Can you turn it up?
Can you hear me now?
Yes, I can. Yes,
okay. It was wonderful to be a part of this really, really incredible effort to create free education for our paramedics and EMTs. I think it's a great way to say thank you for to all of our hardworking EMTs and paramedics. And I've been really looking forward to watching some of the content. I think it's from everything I've heard, it's been some phenomenal presentations. So
If anybody
I
has
look
the
forward to it.
if anybody has the information they could put in the chat, I'd appreciate it, or we'll try to talk about it. Remley was going to talk about it, but she couldn't. She got sidetracked. It couldn't get on. And the same thing, Lauren Maloney was going to give a talk about the cardiac arrest study that we're doing we got the Star Research Achievement Award from the Society of Critical Care Medicine. And I was going to have her present it, but then she got re-tasked to go to the emergency department today. She was supposed to be off to do this for us. And we have a couple others. There's another paper we've talked about before that we heard about back in March about platelets being so important in the COVID coagulopathy. And we're probably going to have a report on that next week as well. So anybody else want to pipe in about anything before I set us off for our Christmas break, right, so to speak, right?
Hey, Paul, this is
Yes.
Jeff Jarvis.
Yes, Jeff.
Just one more thing about Refresh. As a Texan, I would like to point out that we had by far more registrations from Texas than anywhere else. And the competition got me a bottle of bourbon from Georgia. So way to go, Texas.
Oh, okay, good. Is it because they need it more or what?
Could be.
Yeah.
California's catching up. I'll just point that out.
Hey, but what kind of bourbon was it? That's what I want to know. That's the most important thing. I want to know what their taste is like.
Yeah, I'm not sure. It hadn't showed up yet. So I'll be sure to use that as another COVID screening test.
Okay. Chris, Chris, I don't know if you were hearing it. We're talking about Refresh. Can you have any comments about it?
Chris Caldwell, yes, I do. I look at that, the faculty that you all put together, and again, with only one exception, that being me, it's quite it's a very impressive group, and it's been fun to see how that grows. That they had started with a goal of 5,000, as you know, and they've crossed 7,000, 9,000, 10,000 barrier, and keep going. And it's been an exciting project to be part of, and no, it's been great to see how that has progressed.
And a bunch of people have already completed it, and the feedback on the whatever has been outstanding. So I'm very, very pleased. Thank you for all the Eagles that were involved in this project. So
just as a warning, I of course told everybody to give droperidone ketamine to everybody for just about everything. My topic was pain, but I said give it for everything else too. And so when you start seeing that, now that it's gotten out to more than 10,000 people, don't be surprised.
Another drug shortage coming up.
Every time I talk and anybody listens, we get a drug shortage.
Oh, like we can get droperidol anyway.
This is gonna be funny and totally not droperidol related. My apologies. But I think one of my favorite parts of Refresh as one of the faculty has actually been that I'm having people reach out to me from places that I don't think I ever would have been able to talk to them about topics I was so passionate about. And it's been amazing to see, because of social media, them feel comfortable to reach back out to the faculty and ask more questions and ask for more information. It's been a novel approach. And Jeff, just because you guys are registering multiple people several times and registering the dead, that's why you got your Texas numbers up. I saw it on Twitter.
Hey, well, just because we read the rules of the contest and you didn't, doesn't mean we shouldn't get our bourbon.
Yeah.
I'm just saying you should share that, you know.
That I will be happy to do.
Y'all.
Okay, well, I do want to find out what bourbon is. That's important. That really tells me a lot about the quality here. So that kind of thing.
Well,
so anyways, this, you know, and speaking of having the vote often and vote, vote early and vote often kind of approaches to things here, it will be interesting to see what happens in Georgia, by the way. So that would be good. And so with that, I just want to let you know, I got on the scale this morning and I demanded a recount. And so, but as we go into the season, I'm going to get back on my bike again next week. We'll see how it goes. Hey, so listen, I think we're at the witching hour, as they say, and thank you all for everything. This is a great meeting today. I thank you so much for what you said. And Meg, if you don't mind, next week when we do this, if you wouldn't mind putting on this all to put it out again so people know about the refresh connection. Okay, so all right, everybody, anything else? Any last words from anyone? If not, welcome back, my friends, to the show that never ends, next Tuesday, the 29th, at the same time, same station, reporting live from the Hyatt Regency in Orlando, who doesn't have really good internet. It's Paul Pepe, and I approve this message. I'll see you later.
Merry
Happy
Christmas.
holidays. Happy holidays.
Happy holidays. Bye, guys.
Happy holidays, everyone.
Happy holidays, everybody.